Hi, my name is Amber Jusak, and this is my community plan. It's located in Ravenna, Ohio. Numerous studies have proven that elementary schools are breeding grounds for germs and bacteria. One recent study showed that the mouthguard of a drinking fountain within an elementary school actually had the highest number of bacteria of all the surfaces that they tested, which included 2.7 million bacterial cells. The children of Williard Elementary, a school located in Ravenna, Ohio, are no exclusion to this. While there are many different ways one can avoid becoming ill from contact of bacteria and other germs, one extremely effective approach is proper hand washing. Hand washing is the single most effective behavior to prevent illness. Although the facts of how important hand washing is present itself yearly, the concept is often too much to grasp for the young learners. Research has shown that just a one-time intervention can be effective in increasing hand-washing behavior in elementary school children. This is why it was of extreme importance that a hand-washing program was created for the students of Williard Elementary School that tailored their needs of learning. A community is defined as a group of people living in the same place or having characteristics in common. Ravenna is just that, a small community in Portage County, Ohio. Ravenna has a population of 11,805 residents and a median household income of $37,432. The closest major city to Ravenna is Kent, Ohio, and is just a 10-minute drive from Ravenna. Being so close to Kent means that the residents of Ravenna are just a short commute to many different grocery stores and restaurants. Ravenna also has a Level 3 trauma center, Robinson Memorial, and many other healthcare services such as doctor's office, dentist, orthodontist, urgent cares, and a low-income-based medical facility for those who do not carry health insurance and cannot afford high premiums. Also very close to Ravenna is Kent State University, which is a well-known employer and college for many of the residents of Ravenna. In 2015, the citizens of Ravenna earned 142 degrees. Of those graduates, the most popular concentrations included medical assisting, welding, and technology and HVAC assistant. These statistics show us that trades are much more popular and appeasing to the residents of Ravenna versus traditional universities. Ravenna is a town of many different characteristics, such as small, tight-knit neighborhoods lined with sidewalks and neighborhood park and children walking the streets to and from school. Those same children stick together during the summer in after-school programs, day camps, and vacation Bible schools. The citizens of Ravenna can be seen taking all four of their major highways to and from the neighboring cities of Streetsboro, Kent, and Rootstown. Next, we'll take a closer look at Ravenna. After the initial assessment, after the initial community overview, it was important to visit more details of Ravenna, Ohio to make a proper community assessment and analysis. Of Ravenna's total population of 11,400, 46.8% are males and 53.2% are females. The population of Ravenna is primarily white. 90% are Caucasian and only 5% African American. The median resident age of Ravenna is 39.9, which is also the average for the state of Ohio. Although the town of Ravenna has a Level 3 trauma center, it seems that the health of Ravenna still requires attention. Many local healthcare providers within Ravenna and Portage County stated that many of the residents are not using these healthcare services for preventative care, but more a secondary and tertiary type of prevention. A local orthopedic surgeon states that many residents of Ravenna and Portage County that he treats at Robinson Memorial are in poor health. Local emergency room nurses at Robinson make similar statements and confess that many of their patients are non-compliant and undereducated when it comes to the well-known disease processes and their complications, as well as how to avoid them using primary prevention. Primarily, patients often present with flu symptoms severe enough that they require admittance to the hospital, but deny ever having the flu shot. In the United States, seasonal influenza is a disease that causes substantial illness, hospitalizations, and deaths every year and leads to death from other causes, such as pneumonia or congestive heart failure. This is an obvious trend of lack of health education between both adults and children in Ravenna. Next, it was necessary for me to find the correct community partners and resources. Heather Holmes, a teacher at Williard Elementary School in Ravenna, and Cleveland Clinic Akron General. After seeing the need for health education in the schools of Ravenna, it was clear that a proper community partner should be a member of Ravenna School District. Ms. Heather Holmes, a third-grade teacher at Williard Elementary, was an appropriate choice for an optimal community project. Ms. Holmes' community expertise and access to community resources, including the classroom and students, would prove to be an asset in enforcing change in the classroom. It was Ms. Holmes' inside knowledge that led to the realization for a need for health education to the students of Ravenna about proper hand washing. Ms. Holmes shared concerns about absenteeism, illness, and lack of health care given to her students due to the poverty of some family situations. Cleveland Clinic Akron General was also a community partner and an important resource to this project. Cleveland Clinic and their operating room nurse educator provided aid to this project by providing many evidence-based research articles on proper hand washing, as well as many learning materials such as scrub brushes, Purell, gloves, and germ juice for learning purposes. Finding partnerships was an important part in creating the right community project. Combining educators with health educators and hospitals with schools will help create health education in the classroom. Successful strategies for improving community health must include community partnerships as the basic means or key for improvement. My full community health diagnosis was readiness for enhanced self-care among students in the third grade at Williard Elementary School related to lack of knowledge regarding hand washing during cold and flu season, as evidenced by lack of hand washing during the school day, lack of usage of hand sanitizer periodically throughout the day, ineffective hand washing, increased call-offs during cold and flu season, and sharing of personal items with other classmates during cold and flu season. Next, after my community diagnosis, I had to choose interventions. A couple quotes before I chose my interventions included, although the benefits of hand cleansing are clearly recognized, initiating and sustaining appropriate hand washing practices among elementary school children is difficult to the student's development level and constraints in school settings. This is why an exciting and interesting presentation is an important key when teaching the third grade students. The first intervention will include teaching students proper and effective hand washing to help prevent the spread of germs within the classroom. Children are 2 to 3 times more likely than adults to get sick with the flu, and children frequently spread the flu virus to one another. Schools are an excellent place for flu viruses to attack and spread. As a result, families with school-age children have more infections than other families, with an average of 1/3 of family members infected each year. This intervention will include a PowerPoint presentation given to the third graders of Williard Elementary School. Before presenting the hand washing presentation, the students' current knowledge about germs and hand washing will be assessed. They will be asked to explain what they know and what they wish they knew about germs and hand washing. The PowerPoint will have illustrative instructions and video footage on proper hand washing. Not only will the PowerPoint have instruction on hand washing, but it will also include other helpful hints to avoid illness during cold and flu season. This education will include covering your mouth when coughing or sneezing, washing your hands or sanitizing your hands after coughing or sneezing, and not sharing personal items with other students. After the presentation, the knowledge learned will then be tested. The students will then be asked to demonstrate proper hand washing and to name different scenarios where they should wash their hands and if they should be done before, afterwards, or both. This will help us properly evaluate their learning. This presentation will be implemented in the classroom setting, and to make it more interesting and interactive, students will be rewarded with candy and other prizes for proper feedback and for being interactive within the presentation and evaluation. To further gain the interest of the third graders, they will also have a chance to use surgical attire used by surgeons when scrubbing into a surgical case. That was provided by Cleveland Clinic. To help keep things interesting for the students and to further show the importance of minimizing germs to decrease the presence of illness. Next, I will evaluate my community plan. To properly evaluate my health plan, each student will perform at least one effective hand washing, state at least one instance when alcohol-based sanitizer is acceptable, state at least one scenario when a full hand wash should be performed, and lastly, name 3 ways that they can protect themselves against germs and illness during the day. If any one student cannot do all of these requirements following the presentation, more education to that single student will be performed. The student will then be asked to repeat the requirements for the evaluation. Short term, this evaluation will prove if the intervention was effective or not by the end of the school day. Long term, further analysis can prove if this prevention was effective or not with the help of the school administration and staff. The office staff will look at absenteeism and compare rates to previous absenteeism rates before the hand washing presentation. Another long-term evaluation will be made from hand hygiene statistics taken by the teachers following the weeks of the hand hygiene presentation. The teachers have agreed to do a survey for statistics on how many students properly practice hand hygiene after using the restroom, coughing, sneezing, or before they eat lunch. This provides numbers of the amount of students who are compliant. It will be considered successful if 90% or more students are hand hygiene compliant. If necessary, another presentation will be scheduled, and we will then go over more questions and find out what the learning barriers may be. In conclusion, the students of Williard Elementary School were able to learn the importance of effective hand washing to keep themselves safe from germs and the dangers of cold and flu season. With the proper education, students can use their knowledge to not only help prevent the spreading of germs from one another to the classroom, but will also help prevent the spread of bacteria and viruses at home to their families, of which will result in a healthier community in Ravenna, Ohio. And here I just have a couple more. I have some references if anyone's interested. Thank you.